Hi there, welcome. My name is Janet and I'm a licensed professional counselor and I have specialized training in ketamine assisted psychotherapy. Now, I'm not a doctor, I am a counselor, so all of my information is based on my own experience in my own practice and what I have personally experienced anecdotally in the use of ketamine. So, anyway, this is a series of 1 in 6. The first one, which we're doing today, is how do we pick our provider? Okay, so let's talk about that for a minute. First of all, I think that your provider, I know that a lot of them are advertising on Instagram, TikTok. They're advertising on a huge amount of spaces. And how do we know which ones are actual quality and which ones really don't care about us and are looking more for marketing strategy? We need to remember that ketamine is brand new on the market for the use in mental health conditions. It has only been approved for depression, and that's only one specific type. So everything else is being used off label. So that means everybody gets to create their own protocols. So some of these protocols may not be aligned with the current research. So that is what I'm here to talk to you about today. There's several different kinds of providers, and so that's what we're here to talk about. What type of provider? Some of them are psychiatrists, some of them are therapists, and some of them have an AI model. So which one is right for you, right? Some of them provide coaching, others don't. So let's look at the types of providers. Are you looking for a psychiatrist? If you're looking for a psychiatrist and you'd also like some other drugs to go along with your ketamine, then a psychiatry approach might be the best avenue for you. If you're doing your own mental health work, perhaps you have already been through several different modalities of therapy and they haven't quite worked for you, and you're trying a DIY and you want to try one of these ketamine kits, then that type of provider, a counseling type provider, might be better for you. Or perhaps you're completely DIY and you think you know everything you need to know about ketamine and you rather use an AI provider. All of them exist in this space right now, so you get to decide which one is best for you. Next, we need to talk about the delivery method. Okay, that is the type. Okay, so there are several different modalities out there again. One of the new providers out there is offering low dose microdosing. I don't know where they have come up with this idea because it doesn't actually align with the current research is being done, but they have decided that a numbing effect daily is beneficial. Well, some of the bad things that could happen is we could have bladder problems with that, and also we get a numbing effect rather than a treatment. So if you are looking more for a daily numbing, then that's probably the provider for you. Those usually align with a subscription model so that they can send that out to you every month. Okay, so there's that type. And then there's the troches and the powder tabs. There's also some capsules. Okay, on the capsule version, I do not have actual direct experience with this, but it would be a delivery through the gut. So because of that, you're going to have a less of a psychedelic experience, and also you're more inclined to get nausea and that type of thing. So that is another modality that I'm seeing out there, but it's not the prevailing ones. The prevailing ones are the rapid dissolving tabs, which are powder tabs, and the other is the troches. The troches are more like a starburst, and you bite them up very small in your mouth and then you swish them during your dosing. The powder tabs, my partner prefers those because he doesn't like to chew things up very much. They dissolve under your tongue. Both of them give a very similar experience. The powder tabs can give a quicker psychedelic experience rather than the troches, But the troches, for me at least, give me something to do with my mouth when I'm going through that difficult dosing period. Now, some people may prefer the powder taps, like my partner. He just wants to put it in his mouth and begin swishing in the next minute. I, on the other hand, like to do something with my mouth for 3 to 5 minutes. So you pick what works for you. Those are the delivery methods that usually come with an acclimation dose of around 400 and then a therapeutic dose around 600 to 800. That's what I'm mainly focused on, that type of kit. Those are the ones that I work with in my practice and I use myself for my own mental health. Next is the prescriber evaluation process. Are they checking you with a doctor or prescribing physician or a nurse practitioner? You need to see if they are going to give you an appointment like that, and then they should, because this is a controlled substance. So you do want to have that kind of evaluation. And the things they should check are your heart, because ketamine can spike your blood pressure. So if you have uncontrolled high blood pressure, ketamine may not be right for you. So they need to ask you about your blood pressure, your current medications, and your mental health status, because all of those things are going to affect your ketamine experience. If they do not ask those 3 questions, they are probably not qualified to be giving you anything. Ketamine is not the right medication for certain mental health conditions, specifically psychosis. And then also there are some personality types that just shouldn't be even attempting it. That is a screening that you should go through with your provider, as well as any medical conditions that you might have and any medications you're taking, because some medications can affect your experience. So if they're not asking you what kind of medications you're taking or asking you to abstain from this stimulant or that depressant, then they aren't really taking good care of you. So that is another thing to look for. The next thing is the transparency of support. Do they have an app? Do they have a dashboard? How are you supposed to get follow-up care? Do they have an emergency number? How are they going to take care of you after you purchase your medicine? You need to look at that support system. Does it feel good? Does it feel like, oh, I can do this on my own? That is the next thing that you need to do. Again, another very important one is the cost structure. Can you afford it? Normally, in most of these companies, you have a start-off pack that costs a bit more, and then the maintenance doses come down a bit. Make sure that's happening for you, because some aren't offering that when we know others are. So I don't want your ketamine to be more expensive than it needs to be. So be sure to look at the cost structure. The next is it a tangible fit for you? Does it feel good? Did you get the feeling that they're on the same page as you? I personally use Better You. That is my preferred provider, but I have used 2 other companies prior to this. The reason why I prefer Better You is, first of all, their cost is probably the best that I have seen, okay? But the second reason is because they're very dedicated to the psychedelic work. It's actually written on their advertising, psychedelic therapy. I have found other companies to be very conservative in their approach, and they are very concerned about how much medicine you have, how often you take it, whether or not you have a sitter or not. It seems to me that they're fussing around the periphery of treatment, but they aren't actually in the treatment, because we really do want you to have a good psychedelic experience, because we do want those new dendrites. But anyway, please write and let me know what kinds of experiences you have had and who your provider is and how you have chosen them and whether or not they're a good fit. So anyway, thank you again for coming in and bringing me both your heart and your head. Let's stay intentional, and you have a good day.